In case you missed it, fireworks on Capitol Hill. I'm Elizabeth Prann, and this is Raising America on the Hill.
I will stand behind scientific integrity with every decision I ever make. If I am put in a position of having to say I will cede scientific integrity to retain my job, then I am not the right person for the position.
Dr. Susan Menares had the shortest tenure as the CDC director in recent history. But what we're talking about today really pertains to families. There's been a decline in investment in the public health system. Why does it matter?
If vaccine protections are weakened, preventable diseases will return. I was fired for holding the line on scientific integrity, but that line does not disappear with me.
In today's episode, we're delivering every possible opinion. We start with Corinne Clark. She's a Republican strategist and a founder of freepressfail.com.
And I think after COVID especially, people are more reluctant to hear this health news coming from government sources. And whether or not that makes you upset, it's just the fact. People are not willing to trust HHS and CDC.
Tim Leshan is from the Association of Schools and Programs for Public Health.
We may have prevention research centers across the country just disappear overnight.
We're also going to hear from Dr. David Margolius. He's the Cleveland Public Health Director.
When the president is making threats about freezing all funding, when future budgets are looking at huge cuts to public health, it just makes it really hard for us to be able to do our jobs.
And last but not least, Nikki Bostwick, the owner of Fullest Company. She goes into her journey from being a Democrat to a voting Republican mother.
I don't believe that budget cuts are going to cause us to go backwards. I believe that budget cuts are going to make it so that we have to be more efficient and focused.
And get this, at the end of the day, so many of our panelists agreed on so much more than we thought they would. And that's because we're talking about the silent majority who just wants the best for the next generation. We talk about what we're seeing out of DC this week, and the former head of the CDC, Susan Menares, will be facing senators. And certainly we've seen this before, right? We've seen her really just months ago facing a number of questions when it comes to public health. There's no disputing that there have been funds that have been taken from the CDC. There have been well over 2,400 public health care workers who have been laid off. We've seen billions of dollars, whether it's for the NIH or for CDC funding. So your take, as you've watched really the past 6 months, we've just seen a lot of changes. A lot of public funds are being pulled.
Yeah, it's really concerning because I have a department. We have a budget of about $26 million. We have 150 employees, and we are planning for the moment that we're in, and we're trying to plan for the future. And when the president is making threats about freezing all funding, when future budgets are looking at huge cuts to public health, it just makes it really hard for us to be able to do our jobs, to encourage growth within the department, to have job security for the folks doing the work of preventing diseases in the city of Cleveland.
Okay, Corinne, I want to bring you into the conversation because there are critics who will argue that there are always room for efficiency. There's always room for improvements. Your take on really what the administration has done in just the past 6 months or so?
Yeah, well, I think that argument for efficiency and for improvements and even for budget cuts is more relevant than it ever has been, because just the fact of the matter is that in 2020, we inflated the budget of HHS and CDC to deal with a pandemic. That makes sense. We were dealing with a pandemic, but we never cut the budget after that. We never cut the staff after that. We recently fired 2,400 people. That puts us basically back at 2020 levels. We had never had a CDC or an HHS as big as it is now. And we're kind of like dialing it back to a normal, efficient level. We shouldn't be operating at a pandemic force right now. We're not dealing with the pandemic.
Tim, I want to weave you into the conversation here because we have seen, and I remember even during the hearing that I watched in June, a senator said, listen, we have a massive increase in chronic diseases, autoimmune disease, young people, and really even disabilities on the rise. And we're throwing more public funds at it, and we're not necessarily seeing the the result. Do you agree with that statement or no?
Liz, thanks for having me. At the Association of Schools and Programs of Public Health, we're training the next generation of folks who work in this field. And we believe in science, and the science indicates that we are making progress on responding to these diseases. Are people still struggling? Absolutely. And we need to make sure that families across the country have the resources and the knowledge in order to make smart, thoughtful decisions about their health and their family's health. And we believe that that's what we're trying to do. And I think that's really what we're hearing from the MAHA movement as well. They too want to make sure everyone is healthy, and that's our goal as well. We just probably think about it a little differently.
But I want to bring Nikki in the conversation. When you think about it differently, how so? Nikki, you've been on the ground listening to families. Would you consider yourself involved in the MAHA movement, and just your observations?
I consider myself heavily involved in the MAHA movement early on. I've been a supporter of RFK Jr. for years now. And as a mom that cares about wellness, as a human that cares about my own well-being, the well-being of my family and the people in this country, and also a business owner, I feel like I have a really unique perspective on this, because I believe in science, but I also don't believe it's rocket science to understand what's causing our children and our people to have all of these chronic health conditions. And just based off of what we know that hasn't been working, I don't believe that budget cuts are going to cause us to go backwards. I believe that budget cuts are going to make it so that we have to be more efficient and focus on the treatments and preventative measures that actually work. And I think that we know that there's environmental factors, there's overprescribing of pharmaceuticals. There's so many things happening. I don't need to necessarily say every single one, but I think that we know what works and we know what doesn't. And there's a lot of room to cut funding and be more efficient. And that happens in business as well. In business, sometimes there might be too many cooks in the kitchen. There might be a lot of waste, and we need to get clear, go back to what's working, get clear on what we need, and then move forward from there. And then from there, maybe if we need to ask for more budget, it's because we have all of this information to prove why. Here's why it's worked. Here's why it's drastically working, and why we need to focus in this area. But until we see that, I don't think that, our track record or the CDC's track record hasn't been that great, in my opinion.
So, Dr. Margolius, if you heard what Nikki was saying, that would be the argument. Listen, there's administrative bloat, right? That it needs to be more of a finely tuned machine. But you also heard her say that maybe some of the public sentiment, the public support is being lost. The trust is being lost. How does that make you feel? This is something that you've dedicated your career to.
Well, yeah, I will say, Nikki, what you were saying, I really resonate with. So I was a doctor, in a hospital prescribing medications, and I left that world because I was getting discouraged based on, what I was seeing, folks with like progressed chronic diseases, people dying of preventable illnesses. And so that's why I went into public health in the city of Cleveland to be the director. I see that our lead poisoning rate in the city of Cleveland, lead, the heavy metal lead, because of old paint in our homes, is the highest in the country. And so I went into public health to work on fixing those environments, fixing homes. Our smoking rate, all the toxins that come with cigarettes, our smoking rate is one of the highest in the country at 20% right now. And so I'm here to do that work, to make America healthy again. But unfortunately, it's not translating, right? Where the lead poisoning program at the CDC was cut. They ended up rehiring everybody, which is great. But that kind of confusion is not helping me prevent illnesses. It's not helping our department reduce the number of medications prescribed here in the city of Cleveland.
Okay, so Corinne, where's the disconnect, right? We all want people to not be sick from lead poisoning. We all want people not to be smoking. And I actually heard a senator really push, now the former director, Susan Menares, at her last hearing, because there has been cuts to that, as we just heard. But you also hear folks say, well, that's not what we should be spending funds on. So where is the disconnect, as parents are so confused?
I think it is really hard too, as we've talked about, the degradation of trust in these institutions, and people are unwilling to spend billions of dollars to give to the CDC so the CDC can tell people to stop smoking. It's like, yeah, we know smoking's bad for people. We've been hearing the ads for 30 years and no one wants to hear it from the CDC right now. They don't even like those people. They don't even trust those. And I think after COVID especially, people are more reluctant to hear this health news coming from government sources. And whether or not that makes you upset, it's just the fact. People are not willing to trust HHS and CDC with every health initiative. I think we do have these powerhouse people right now. We have RFK leading this movement and people are willing to hear from him, but I don't really think that people are looking for the government to solve every issue. We do need them actually to instead pull back on some things. Like, your hand was in this was making people sick. We don't want you to do that anymore. And I think that that's what RFK has been doing in a lot of ways, is just showing people, like, the government was actually encouraging this action that was making people unhealthy. We're going to take the government out of this action. The government was influencing this type of food or this type of program that was making people sick, and now they're no longer doing that. So I think we are at this turning point where we are going to see some pushback from people, but a lot of this is not about the government getting more involved to make people healthy. It's about the government getting less involved in the actions that were making people unhealthy.
So
Tim, go ahead.
Yeah.
Go ahead.
Yeah, I mean, I really disagree with that perspective because, what the CDC's mission is to try to make everyone healthier across the whole nation. And what they do is they use science and evidence to determine what is the best approach people can take. Now, whether or not families are able to get that information and use that information correctly is another thing. But in terms of what the CDC was created to do, it has done its job in terms of letting people know what the actual science is and what the health recommendations are. And I don't agree that, people don't trust the CDC. I think a lot of people have been told not to trust CDC, and they're believing that, as opposed to those who follow the science and are focused on what can we actually do to help the families of this nation.
I think I have much more faith in the American people, that they don't just take something. No one's telling them not to believe the CDC and then they just don't believe the CDC. Instead, we've had years of evidence where the CDC has failed people, and then they've decided not to trust the CDC. Americans as a whole are not stupid people. I think moms especially are very concerned about the health of their children, and they have come to these decisions based on the failures of the CDC in the past. I'd also like to push back. I don't think the CDC's mission is to make America healthy. It never has been. It is the Center for Disease Control. It's never been the center of health and science to make families prosper, to make families more healthy. And that is just mission bloat and a lot of people who are taking a lot of pride in something the CDC was never actually designed to do.
And I just want to add to that, when the CDC recommends that families mask their young children and send them to school with masks, and there's no science to back that up, and the 6 feet rule and all that, it just makes families not trust the CDC. It's not because all of a sudden we just decided one day to wake up and not trust it. It's just that we don't think that everything is backed by science. And I just want to say one thing, the lead conversation, the heavy metal thing. Yes, that's true, but no one's profiting off of that, right? It's just truly, genuinely because we want to remove heavy metals and lead. You, for example, I'm speaking directly to you, doctor.
Yeah.
You're not profiting off of trying to remove it, but there's certain partnerships that are in place that feel not aligned and not for the American people and the public, and that it's really to put money back in the hands of these certain billionaires and people that are meddling with our health system. And so that's where the disconnect is. And I think that I think that's why it's beautiful that there's now going to be more transparency. It feels like, we don't know. I mean, people just voted this administration in based off of certain promises, and we're still waiting to see. I think some have come through, and I believe I mean, I was a supporter of it. I held fundraisers. I personally believe this because I want what's best for my children and the next generation, but I also am waiting as well. And I think that there's always two sides to every story, and I'm always willing to see both perspectives. And I think that ultimately there are certain things that happened, especially in 2020, that just parents can't. Speaking on behalf of parents, it's like to say to me that I need to mask my children that are aged 2 years old and are not the population that needs to be masked is just terrifying for us to see what else they recommend for us to do. I wasn't able to walk into a restaurant without showing a certain card in Los Angeles. I wasn't able to walk into many places because I was perceived as a threat, but now today I can. I don't understand that.
Well, that's how science works, right? You come up with an intervention, you test it, and you determine whether or not it works or not. And I think what we were doing during COVID was to try to bring down the number of people who were sick so that we didn't have too many people in the hospital and too many people dying. And we did that, right? Now, did the science evolve? Did things change? That's how it works with science. You have to learn from your mistakes and learn from things that happened in order to change policy. And I think you saw that. And, yeah, we're not being required to wear masks, but COVID still exists. And we all have a responsibility to try to protect one another. That's what public health is all about. It's about protecting the whole. We care a lot about individual rights in this country, but if we only care about ourselves, we can't have public health, because public health is trying to protect everyone, and everyone should be part of that. And we have to make sure that folks have that opportunity to do that based on sound science and sound information.
But and I want to bring the doctor in, because is it valid that these families are feeling sort of a whiplash? So, and I want to actually bring the response from H1N1, which was years ago, and then the response to COVID. And I know it's sort of apples to oranges, but there was a lot of trust in the CDC then. There's not a lot of trust now. And is it really on the onus of the CDC and public health officials to say, you can trust us and here's why? If you bring back some of those mass examples that Nikki had, it did feel like we were being test dummies, but we weren't being told, hey, this is a test dummy. We were being told, this is how to prevent the spread, right? There's a difference there.
Yeah, I mean, I'm Nikki again. I'm aligned with you. I have young kids. They're now 7 and 10, and so they were 2 and 5 during all that, 3 and whatever. And I think there are folks who owe you an apology, and other parents of young children, because we, the royal we in public health went overboard on especially childhood masking and closing schools that, we recognize now the huge learning gaps. And so I think the apology would go a long way to help rebuild trust. But I think the challenge is, like, the CDC, yeah, they do the masking recommendations, some vaccine recommendations, but there's so much more that the CDC does. Most of the money that goes to the CDC goes from the CDC to places like Cleveland, into local governments. It's not sitting in Atlanta. It's all going out into the community organizations that are doing good work, that are trying to make America healthy again. And so when that money freezes up and there's uncertainty, I don't feel that there's transparency right now. We don't know, what money is coming or not coming, because it doesn't seem like at this point there's a plan. And so that's making it really hard for us to be able to do the good work of preventing disease. The lead paint issue, it was government that way too late finally stepped in and prevented lead from being in paint. Like, if government hadn't done that, it'd still be in paint today. And so there's not going to be another non-governmental organization that stops these heavy metals, these toxins, from going into what we're consuming. And so government does need to do something to help prevent disease.
Well, then let me bring that to Corinne to play devil's advocate, because you probably want to preach, I would assume, smaller is better, less is more. But if you hear what the doctor says, where is the clarity going forward that there still will be some support?
Yeah, I think again, we have to be realistic about the budgets here. Like, I'm not sure why all of these health departments feel that we should continue to operate at pandemic levels of spending with zero accountability to the funding. And that is just a fact. We have not dropped a budget since 2020. They're finally cutting staff. They're finally cutting the budget. You can shake your head, but it is
It's
literally
not
the
a
truth.
fact.
It is a fact. There's not been a budget cut to the CDC until the last continuing resolution, which actually didn't cut the budget. It made sure that the budget didn't continue to inflate at pandemic levels of recommendation. That is just a fact about
our
federal
COVID grants
budgeting.
expired in
You
2022 here
can
in
literally
Cleveland.
look it up. Anybody can look it up. That is a fact. And I think a lot of people in public health, and this is another reason that people have such degraded trust in the institutions, is because public health has been used. They function to get more money for public health. They are lobbyists on behalf of themselves. They get more money from taxpayers again and again. And as Nikki said, we don't have a lot to show for it in results for families' health. We actually have recommendations that people feel are threatening their family's health. So I do think there is a transparency. I think President Trump was pretty clear with it. RFK was pretty clear with it. Things are about to change. That's pretty transparent. I don't think we can count on Biden era budgets for public health. That's also transparent. I think they need to adjust and make decisions based on that idea moving forward. And I do think we need to be honest with the fact, like, yes, the government did, just for health policies in general, but if we're using lead paint, the government did step in after moms and communities brought to the attention of the government for years that their children and their families had been hurt by lead paint. Finally, after so many moms and so many community leaders brought it to the attention of the government, they step in. That is another example of how this kind of change actually comes from families, not from the government. And it's not this government always stepping in to be the hero. The hero of this story is actually moms.
I would actually want to. Well, David, I want you to respond, or Doctor, I want you to respond to that, and then I'm going to.
Yeah, I don't disagree. I mean, the hero is definitely the moms. Usually, is the moms. But there were other countries that banned lead and paint, and the beginning of the 20th century, and it took the United States so much longer because the industry was saying, no, lead and paint is the best kind of paint. And so those types of things are happening now. And so I'm so excited that RFK wants to ban pharmaceutical advertisements from television. Like that is awesome. That nobody on either side of the aisle should disagree with that. If they do, they're clearly getting funded, right, by the pharmaceutical companies. And so there are things we can do to make our food healthier, but it's going to require a government workforce studying the science, making decisions, and then executing to make sure that we're all healthier as a result.
I also want to just say that I don't think anyone's arguing that the spending at the CDC was perfect. I do believe that there are potential changes that could be made at CDC. What we're lacking is any kind of strategy to do that other than cut and slash. And so what's happening, programs like the prevention research centers that are at a lot of our schools and programs of public health that have worked for years and produced tangible results in terms of not only the science, but the impact of that science for things like working on obesity, they don't know if they're going to get their funding this year. They're supposed to have had their funding by now, and we don't know if it's going to happen. So we may have prevention research centers across the country just disappear overnight. And while you might argue about whether or not we should have prevention research centers, changing something overnight is not the best way to manage this situation. And it's just like, the firing of Dr. Bernardes, she was confirmed by the Senate by 51-47 on July 27th. And then by August 28th, she was fired. And so that is giving people a lot of distrust in the system, because we thought that the president and Mr. Kennedy thought that she was the right person for the job. But now she's been fired less than a month later. Where was the vetting? Why didn't they figure out they weren't going to agree on things? So I think part of the problem is just some real disarray in terms of how HHS and CDC are operating. Not that we can't be more efficient, but we just have to have more order.
Nikki, I do want to get your response on that because to be perfectly honest, I mean, I listened to that hearing in June and it was fiery, right? So she had to fall on the sword as they typically do. And then it was whiplash, right? When she was removed. So if we're trying to instill trust in the CDC, is that what you want? Do you want to trust the CDC or I mean, we're villainizing her or are we not? Your take on that?
I'm not saying that I don't want to trust the CDC, but the only time that any recommendation I've ever seen from the CDC is like during well visits with a pediatrician, right? So outside of that, I mean, it's like when you're traveling, or what you're saying is you have these research centers in schools, let's say for obesity. So that's interesting to me because I'm wondering, okay, what does that mean? Are you looking into preventative measures like exercise and eating well, or is there also prescribing Ozempic and being involved? And I mean, I don't know, but that's on the table, or was on the table at one time. Mr. Kennedy talked about that at certain events, that was something that they were looking into doing. I didn't necessarily follow along with what happened, but in any organization, you can think that you're bringing on someone that's super aligned, and hopefully more quickly than not, you're going to get rid of them if you find that that person is not aligned or not the right hire. And that's not rare. That's not uncommon. And so I don't necessarily feel any whiplash or that I can't trust them. I think it's so early, but I will say that a lot of what I've seen come through seems very promising. But to your point about when there are budget cuts and having a strategy, I think I totally understand. Like, it feels like, I think that happens in a lot of organizations though, when you start making changes and it's like, okay, so what are we doing with these research centers? Are we not going to have them anymore? And what happens to those people? And there's so much confusion early on, but we're still just getting to that place where people are figuring it out, and we don't know I obviously don't know, but I trust that everything will realign. And when things do, only the things that are super important, that have the most sound science, will probably take priority until the rest can come up from there. But when it comes to our children and obesity, we know obesity isn't normal. And in the media, they've tried to normalize obesity. And that's outside of the CDC, but it's the CDC, it's our government's job to say, no, this isn't normal. And you can do things at home to make sure that you aren't obese, that you prevent this disease from taking over your family. It's not okay. It's not normal. And it leads to other issues. And we saw during COVID that yes, COVID is still, alive and well, and it's still spreading, right? But it's the people that were obese that had the most problems. It's people that had autoimmune conditions. I'm someone that has Hashimoto's, but I was told that I need to be on thyroid medication for the rest of my life. This is a prime example. For the rest of my life, I need to take thyroid medication. But I went to a functional medicine doctor and I reversed my Hashimoto's. I don't have Hashimoto's antibodies. And what I want to see for this country and for our children is talking about how diseases can be reversed and how I did that without pharmaceuticals. So it's not a miracle, it's possible. And we need to talk about this more. And I know that public health is for the whole, but you're seeing families looking to homeschool now. We're interested not just in individual rights, but we're interested in individualized healthcare because the public health model hasn't been working. And I would love to see a situation where public health and individualized healthcare can meet. I don't know if that's possible. I don't know if that's it's the antithesis of each other, but maybe there's a way where we don't have to sacrifice the health of many people that are starting to show autoimmune signs of autoimmunity, autism, and all of the other diseases. that we're seeing at the expense of all these people, because what's happening is most people now have a low quality of life because of it. And we want to be thriving. We don't want to just be keeping people alive medicated.
So, doctor, I want you to respond to that, because what I really hear is, well, why aren't we adjusting public health, right? Because it's not working. So, how do we appeal to the Nikkis of the world, which there are millions?
Yeah, absolutely. I think it's really tough based on your experience that you clearly, had some bad doctors, right, who told you you had a lifelong illness when you didn't have a lifelong illness, right, and you got better. But public health, it is working. When you look at life expectancy over the last 100 years, I mean, it's gone up and up and up and up until the last few years during COVID, and now it's starting to climb back up again, especially as drug overdose deaths decline because of public health. And so I think it's hard to say it's not working when it's working its best, it's invisible, and you see people living longer, healthier lives. And that is what's happening. Now, what is not working is the medicalized healthcare system, where people now are feeling more like peons in a system, and cogs in a wheel, and aren't getting the individualized care that they want. But public health, we should be in the background. We should be making sure your milk's not expired. There's lead, not in your paint or your water. I mean, that's where you want us, in the background, not political, just, the smartest people, well-resourced, doing the work to keep you healthy and your family healthy.
All right, so Corinne, I'm going to put you in the hot seat because I know you can handle it. I'm going to say a statement, and it's going to be bold, and I'm going to do it intentionally. This administration has politicized public health and created distrust. Your response?
I mean, I think public health is inherently political because it's a government intervention in our daily lives that is always going to be a political action. I would say this administration has made it political. I think that they've been very clear that they were going to make it political, but they are not the first to do so. They are the first to be transparent about it. I think RFK was a huge part of Trump's campaign. A lot of people voted for Donald Trump because of RFK, and I'm happy about that. As a lifelong Republican, I'm happy that our coalition has grown so big. But these are real issues that are actually bipartisan issues. I think Democrats for my entire life have been concerned about the interest of big pharma and big corporations and how they influence our health in a way that doesn't affect our health positively. RFK is now getting in there, dropping some hammers and saying we're going to look into all of this. And now we all of a sudden have this pushback as if public health is something that is unimpeachable and we can never look into it. That is also a politicization of public health. This idea that we cannot scrutinize, that we could not be critical of policy, that's a politicization. This is just a very political thing. It always will be. It actually always has been. And I think it will be in the future as well. But it is good that right now, I think that we have the most involved Americans in history. The most people who have ever been interested in public health policy ever. This is something that nerds used to talk about in corners. I know, because I was one of the nerds in the corner talking about it. But this wasn't something that moms talked about at dinner. And now it is. And I'm very happy that that is happening. And I do think there will be some pushback, and there's always going to be a little chaos when you're changing the system. But it has to be changed. And I'm really glad to see this administration take on that role.
All right, Tim, I'm also going to put you in the hot seat on this one because we've been talking to moms since we started this program. And one of the things that I find most compelling about the MAHA movement, about the loud voices when it comes to public health, among other issues, is that it really doesn't fall up and down party lines. Certainly part of RFK Jr. will align itself with the Trump administration, and you'll see it fall up and down party lines. But there are a number of very liberal, progressive women who I have talked to who support the dismantling of some of these CDC programs. So it's hard for me to say this is a Republican and Democratic thing when really it's this silent majority that we're seeing, or you may say minority. I'm interested to hear your response that it's not necessarily just Republicans who are critical. Would you agree with that, or would you disagree?
Yeah, I think that's right. I mean, I think we're all concerned. I'm a dad. We're all concerned about our family's health and really want to affect change there. And that's what public health has always been trying to do. Is it perfect? No. Should it be scrutinized? Absolutely. Should it be partisan? Absolutely not. we should all be fighting for making America healthy again. I wouldn't use the word again. I would just say make America healthy, because I don't think we ever were healthy. And so I really think this is a great moment. I agree that everybody is talking about public health. So let's put it on the right trajectory to be as effective as possible. And let's use the science and the training that we need for people to make sure that that happens. And so, yeah, it is kind of a bipartisan issue. People want to make sure that their families are healthy and that we're all healthy. And we can all get behind that. It's just a question of how we do it and whether or not the mechanisms that are set up to do that in the federal government are working as effectively as possible. That's what Congress's job is to do. They're supposed to review what the CDC and other agencies are doing, have oversight. That's what this hearing is going to be tomorrow, where they're going to do some oversight over the CDC and look into the details there, and then provide recommendations for change and maybe cut certain funding or add certain funding that they think is appropriate based on what they know and what they're hearing from their constituents. That's how the process is supposed to work. So that's what I hope for.
And before I let everyone go, Nikki, have you ever been this energized about a political issue before in your life?
I would say no. I mean, I've been the most involved that I've ever been in this last election. But to your point with it being a bipartisan issue, I was a Democrat. I was a registered Democrat. And in 2020, I voted for Trump. I was so up in arms about him in 2016. I voted for Hillary. I couldn't stand him. I switched party lines in 2020 specifically because, not that I necessarily would say I'm a Republican, but I'm more conservative. And it specifically was individual rights and my freedom and the freedom for my family that caused me to vote for him in 2020. Then in this last election, I voted for him, and I was happy to vote for him because of RFK. Before, I wasn't necessarily happy to vote for Trump. I didn't think there were so many things as a liberal that I cared about when it came to the environment, and I didn't think that our views aligned. And what surprised me the most recently, now having voted for him and having RFK in there, was this glyphosate issue, just going back to like the environment and our food system and the health of our families. Glyphosate is a really big issue in this country, and there's a hearing nationwide trying to give them shield from liability. And this is what happened to the vaccine manufacturers. They have a liability shield, and we don't want to see that. And what I thought was very interesting was that most Democrats said that they didn't want to shield them from liability, and it was the Republicans that voted to provide them with this liability shield. And that really opened up my eyes, because we're still not there yet. Just because Trump and RFK are saying something, or Trump brought in RFK, right? But it doesn't mean that all of these other Republicans are aligned. Yes, some of them are all about MAHA, some aren't. And there are Democrats that, like you said, are interested in MAHA and interested in health, but some that are more aligned with these pharmaceutical companies and maybe get paid. And so it really is a bipartisan issue. I feel like that more than ever now. And it's having just coming on this podcast and talking about it, because I felt some level of sadness when that happened, when that hearing happened and I saw that. But I'm almost more inspired now, because I feel like there are people in my family, there are people I absolutely love, I have different political opinions about, but we all care about the health and well-being of each other. And so if we can all get aligned on that, I think that there will be so much more kindness in the world. And remember that we all want what's best, and we have different ideas of what that means. But if we can have these conversations, just like Charlie Kirk did, like, I think truly the world will be a better place.
You know, Doctor, I want to get your response in the last word in here, because I mean, Nikki's just a perfect example. We talk to these moms behind the camera all the time, where we're just not monolithic, right? Parents are not monolithic, and they're driven for so many different motivations. But this is a big driver, right? Our return on investment in our children. So as someone who works in public health, you're probably battling some of these internal interests. So how does it make you feel? Because also your livelihood is dependent on these funds, right?
Yeah, I mean, I let a lot of money go when I went from the hospital to working for the city government, and so it's it's not about the money for city employees for local government. We're trying to make things better, and when I took this role, one of the most shocking things was that both sides of the aisle were so anti-government employees. You know, the progressives coming, after us, like, what are you doing with your time? And of course, the conservatives, you're wasting my money. And so, I think just giving each other a little more grace. We're all trying to make this place better, and just recognizing that the CDC, most of the money that goes to the CD goes out to local governments. Most of the money that goes to CDC comes out so that we can hire folks who are inspecting corner stores to make sure they're not selling expired milk, to make sure that people are following up on lead poisoning cases, to make sure that we're visiting new mothers, after they give birth, to make sure that they're okay and they have everything they need to help their babies live their healthiest lives. So that's what we're all about. That's what we're trying to do, and that's the direction that we're trying to go.
Well, I'm grateful for you all for joining us today. It's such a robust conversation. And I think the bottom line is that, we all just care so much about our next generation, and certainly motivated to do better. So I'm grateful for you all joining us. Again, you're contributing to parents across the nation just getting more information and getting their views out there. So thank you all very much. I appreciate you.
Thank you.
Thank you.